What does innovation mean to you?
For me, I think it's, we're going to keep it really simple, which is anything that's new or different about the way we can do our processes, practices, or if you feel that way, devices, whatever it is. It is along a spectrum from research, and I think we're specifically staying away from research in this program because there are a whole lot of other avenues for research. But any new idea that might change the way we do things, that's innovation.
Now, you and I met about 6 months ago when we travelled to Israel together as part of the Health Minister's delegation to Israel. Can you share a little bit about your learnings and what was important about that trip for you?
Look, Israel was really amazing. I came back really enthused and excited about what you could do and how such a small country had achieved such an amazing turnaround in a really short period of time. For me, what I wanted to be able to do was to bring some of that back to us.
So the purpose of the delegation was to look at healthcare in a different system and technology and exponential technology change. And we saw disruption in many areas. So I'm curious, what did you see that once you see it, you can't unsee it?
There were so many things where you just thought, A, it's amazing that such a young person usually had generated this idea and brought it to fruition. But the use of the technology to support the clinical care in ways which we could only dream of, whether it be acute settings where they were reducing errors, increasing patient flow, reducing time to diagnosis, or out in the public health setting where they're doing population health interventions based on AI imaging to come up with an outcome that flagged a patient as a need for an intervention. The underpinning stunning thing was that you need data to do all of those things, and we don't have a digital record, and that becomes a priority for us. And I think that was one of the really big things coming out at a system level from the trip, that a number one priority for this state, if we're going to live in the modern healthcare world, is we need an electronic medical record.
Now this brings us to an interesting initiative that you've kicked off within North Metro called the Innovative Future Program. Can you share what that's about?
So the Innovative Future Program was really about trying to take us from an organisation which was really focused on the budget as its primary cause alongside patient safety, to saying, okay, we've done some work there, the budget's always going to be there, we're always going to need to meet those requirements, but what can we do differently that's going to create opportunities for staff to flourish and to create better systems and outcomes for patients, both in North Metro and hopefully right across the state in due course. We want the ideas to come from the bottom up, and we want to be able to support staff to have a go at implementing or designing whatever it is around those ideas. We want to give them some executive support to unblock projects and problems that they come across as they're doing it, which is often a big problem when you're trying to do a project from the bottom up. And we want to give them some mentoring and some resources to be able to make that work. We also want to make it really low bureaucracy, so simple to start, simple to stop if we're not going in the right direction, and a constant flow of these projects coming through.
I think there's some interesting principles that make this project quite different from others, at least from my observation. One is what you said about your commitment to minimising red tape and executive support accelerating people through that process. Another part is that people and successful applicants will be given resources to actually support them on their journey and make their problem area or their idea come to life in a proof of concept or a pilot. So with that, what type of resources will people be given in the program?
So we've set aside a small budget in the global sense, but nonetheless a budget to support things that we might need to, I guess, enable them to do. But more importantly, we've got an absolute commitment from executive to free up resources that exist in the organisation in the first instance. We don't really know what resources people are going to need. It might be that they need access to data, it might need that they need analysts to analyse the data, but they might need a desk to sit to do the work they want to do. They might need a bit of time out of what they're doing. So until we know what the projects are and what resources they need, it's hard to say exactly what they are. But we'll pick the projects and then we'll work within our budget and what we've got right across North Metro within our very large organisation to support those, and we'll make them happen from that perspective.
And within the bucket of new ideas, they really vary on a spectrum from relative incremental but really important to big, bold, visionary. Where are you seeking ideas along that spectrum for the program?
anywhere along the spectrum. I think it's really important that everybody in the organisation who's got an idea thinks I can be part of this program. From our patient support staff who have the widest view of the hospital because they're out there every single day in all of our services, to our corporate staff who work in offices and can see major issues with our back-end processes, to the person who's got an idea that might be a technology idea. This project's open to all, and we want to see all the great ideas. The more ideas, the better, the harder our job is.
And for people that are feeling fatigued within the system, what would you say to them?
Look, I recognise that fatigue, and I think it is hard when we are changing all the time. The other side of that is the world, and the healthcare world in particular, is changing all the time. If people are tired and can't be part of the program at the minute, I acknowledge that and I accept that. What I hope is that as people see progress, that they may have a time to be rejuvenated, to take a breath and to join in the program. If something's going on in your area, don't discount it up front because we're tired. Take a look at it because it might actually be the one change that makes your life better.
Now, for people that are watching this and working within North Metro and they want to get involved in the program and they've got an idea or they want to form an idea or learn more about the program's going to work, what should they do now?
Simplest thing, go straight to the hub. The if icon's there, click on it and you'll get all of the information. We're also having some forums at the end of the month in the last week of October, so head along to one of those and you'll hear a lot more about it as well.
Okay, great. Thanks so much, Rob.
Thank you.